Okay.
And then I'm going to take us to Facebook and we will get started.
Okay, great. And then I'll share my screen when that's ready. Just let me know.
Yeah, let me make that happen. Okay, you should be able to share your screen now, Dr. Newman.
All right, sounds good. Should I just get into this and get started?
Yeah.
Perfect. Okay, let me pull up desktop, share. System preferences, or hold on, I got to do that. Let's see if this is going to work to get my allow screen and recording. Why is that not working?
Is it not?
Before, let's see if I can just do Keynote. Share. It's because I don't think I've ever shared from my laptop before, so it's making me go through like privacy settings. But it's not a big deal. I have it all here. I can do it. Otherwise, if I can't do this.
Okay.
Click the lock.
So I'm just going to do a quick introduction while you're doing that.
Perfect.
My name is Leah Murray. I am the executive director of the Shelton McMurphy Johnson House here in Eugene, and we are hosting a vaccine exhibit called Vaccines from Pustules to MNRA. And we lost Dr. Newman. Well, we'll just go from there while he is coming back in. We have been displaying this exhibit since it opened in February, and it features the questions that are commonly asked about vaccinations, including today's topic and our other topics that we have talked about in our other presentations. And I will make you a host again, just a second. Here we go. And so the exhibit runs through Memorial Day weekend. And when you come in the door, we ask, how do you feel about vaccines now? And then we ask you again at the end of the exhibit. And right now we're going to hear from Dr. Ross Newman about vaccinations in youth and infants and their importance, and hopefully some of a little bit about making you feel more comfortable about that. So go ahead, Dr. Newman.
Good. And you guys can see my screen, my slideshow?
Yes.
Perfect. All right. So like she was saying, I'm Ross Newman. I'm a general pediatrician, board certified pediatrician over here at Eugene Pediatric Associates. I'm born and raised here in the community, and I went to Harrisburg Elementary, Middle, and High School. I've been practicing here for about 4 years. And obviously vaccines is a huge part of my life as it pertains to protecting children from infectious disease and keeping them healthy, not just during infancy, but throughout their life. I often tell parents, my job is not necessarily only keep your kids healthy while they're babies, but to prepare them for a healthy life. So a lot of the work that I do where children are 1, 2, 3, and up till 18 is preparing them to have a healthy life all the way through adulthood. I've recently taken up an endeavor on TikTok, answering questions, providing educational posts under the name Dr. Rossum, where we do fun videos, we dance, we talk about a lot of vaccine education as well as other infant things. So I'm going to be referring to that intermittently because I put a lot of time into making educational videos, especially about vaccine education and information. So let's move on. So why in the world do we vaccinate children? Well, it's a pretty obvious answer. We want to keep them healthy from disease. But why are children at risk? Why do children get so many vaccinations instead of adults? Why don't we wait and vaccinate them as adults for these disease processes? Well, children have a really unique anatomy when they're first born. They're completely dependent on mom's immune system for the first 6 months of life. While they're in mom's belly, they get some antibodies and immunity from mom that can last them till about 6 months. And if they're breastfeeding, that can really last a little bit longer. But as soon as they hit 6 months, or during those first 6 months of life, one of their responsibilities is to ramp up their own immune system and prepare themselves to fight off infection. So things that they're exposed to during those first 6 months of life become a very important stimulus for them to develop immunity from those things when mom's immunity starts to wane around 6 months of life. So we start introducing a lot of different diseases in the form of protein particles or virus particles that we can present to the baby's immune system in order for them to start to mount an appropriate immune response in the form of antibodies and immunity memory, so that by the time mom's immunity wanes around 6 months of life, that baby can already have a ramped up and ready to roar immune system and decreases their risk of infection, not just in those first 6 months of life while they're getting their first set of vaccines, but that immunity will actually last them up their whole life. So we are able to vaccinate against a lot of really important diseases. So some of these you've probably heard of. Pertussis is whooping cough, which can be extremely detrimental to infants, can hospitalize or even kill them due to respiratory problems. Tetanus, which is caused by a bacteria in the soil, which can cause lockjaw or a paralytic disease in adults and children. Diphtheria is a disease process that causes very, very sore, very, very infected back of your throats and respiratory tract that can cause children and adults to be extremely sick. Haemophilus influenza B, even though it sounds like influenza or the flu, is actually not a virus or influenza at all, but it's a bacteria that causes two principal diseases: meningitis in infants, as well as epiglottitis, which is an infection of the valve that covers up your airway while you're swallowing. Pneumococcal disease. Pneumococcal is another class of bacteria that cause principally pneumonia, as well as meningitis in small children. And rotavirus is a virus that causes a vast majority of the diarrhea and vomiting diseases that are likely to hospitalize children in their first year of life. And hepatitis B, which is a virus that infects the liver and can cause cirrhosis or hardening and fattening of the liver, which can sometimes progress to cancer. And polio. Polio is a paralytic disease that, even in the 1940s and 50s was rampant across many parts of the world and contributed to death and paralyzation of thousands and millions of adults and children. I'm going to pause there because those are the things that you're going to get vaccinated very first. So when children are born, their very first vaccination comes at birth, which is from hepatitis B. And that's a vaccination that you can choose to get at birth or choose to get at your first well visit, and protects babies not only from their future acquisition of hepatitis B, but if mom by any chance had an exposure or was a positive for hepatitis B, that'll actually protect them right off the bat. So even if mom would have passed hepatitis B to child, the early vaccination of that can actually prevent that passing and prevent the development of that disease process in the child. The other vaccines I mentioned, pertussis, tetanus, diphtheria, Hib, we call Haemophilus influenza B, pneumococcal, rotavirus, and polio, are all administered at the baby's first well check. The baby's non-newborn first well check, because we do a variety of newborn well checks, and that can either be between 6 and 8 weeks. And so one of the questions I get a lot that we'll also address in the future slide is why so many vaccines at once? And I'm going to address that later on, so if that's in your head, just be patient for a second. Those first set of vaccines will be given at 2, 4, and 6 months. The reason they have to be given multiple times is similar to the reason why we've seen that we've had to give so many COVID vaccines. With the first vaccine, you get the initial exposure and you sometimes get a pretty decent immunity, but every subsequent exposure, the body gets better and better and better at handling that antigen and can make a stronger immune response. And the repeated exposure gets the body enough practice that it can have a lifelong immunity. So they actually get it 2, 4, and 6 months. And then they'll also get a booster between 1 year and 2 years. And that's your baby's first set of shots. And I did have a TikTok embedded here. Let's see if it'll play. There we go. So this is what we kind of have in our TikToks that tell us about babies' first vaccinations and some of the things that they're going to cause. And this is one of our main ways that we're now reaching out, especially to young parents that are struggling with misinformations and vaccinations. Sometimes we dance a little bit more, sometimes we dance a little less. And that's kind of the same information we were sharing. So you can look up our TikToks to find more information like that. Those are the vaccines you're going to receive. First of all, at 1 year, you're going to get additional vaccinations, and that's going to be the measles, the mumps, the rubella, varicella or chickenpox, and hepatitis A. So measles, mumps, and rubella are clumped into one class. These are all viruses that can cause pretty significant what we call morbidity and mortality, meaning harm and death to children. They can affect anything from meningitis or inflammation of the brain, all the way to testicular inflammation causing infertility, to lung and liver problems, and used to have a very high burden of disease on the American and worldwide population. And I'll address that in a future slide a little bit too. Varicella or chickenpox is a relatively new addition to the vaccine schedule in the last 15 or 20 years. Even I myself in the 80s, I wasn't vaccinated for varicella, but now my children are. And not all children have to get chickenpox now, and we can prevent some of the 1 in 1,000 or 1 in 10,000 side effects that can come from varicella or chickenpox by a safe vaccination for them. And then I put influenza A or B in here because yearly vaccination against flu is very important. Flu is another virus that both A and B types can cause severe illness, pneumonia, many hospitalizations, and deaths each year result from influenza. And I have another little blank spot here because we know that COVID vaccination for infants and children, Moderna will have their first meeting to talk about authorization for that vaccine for 6-month-olds to 5 years old. And I have a feeling, as well as my infectious disease doctor friends, they have a feeling that COVID vaccination will become a yearly schedule too, because it's not leaving us anytime soon, as we've kind of learned. So let's get to some of the common questions. Why do we vaccinate them so young? So I've kind of touched on this a little bit. Our job as pediatricians and parents is to make decisions for our children that will protect them for their whole lives. We're not just trying to protect them from early illness and keep them out of the hospital in the first year of life. We're trying to protect them from themselves and from infectious disease for their whole lives. So do infants need vaccination? The short answer is extremely yes. So childhood mortality in the early 1900s, depending on your part of the world, was between 20 and 40% for children under 2 years of age, which means that 2 out of 10, 3 out of 10, or 4 out of 10 children would oftentimes not make it to the age of 2. And a lot of this was due to infectious disease. And as I'll show on a later slide, a lot of these infectious diseases are the ones we now vaccinate against. And the reason why is because children have such young immune systems, they're not mature and they don't have the capability to robustly react to a lot of viruses and bacteria that can make them very sick early on. And they can progress to serious bacterial infections that cross their blood-brain barrier and cause brain infection very quickly. So the prompt vaccination for many bacteria that can cause serious bacterial infection, even as young as 2 months old, can save a lot of infants' lives. A good example is how the medical field handles children who are under 3 months old who have a fever. So even as soon as 20 or 25 years ago, all infants under the age of 3 months, if they had a fever, it was required of them to be admitted to the hospital, receive a lumbar puncture, be started on broad spectrum antibiotics, and watched for at least 48 to 72 hours to make sure they didn't have a serious bacterial infection. The reason why is Haemophilus influenza B meningitis and pneumococcal meningitis. And all these bacteria were so rampant that many times so many infants were dying of meningitis that all infants under 3 months were hospitalized. With the advent of vaccination, widespread, that has now changed drastically. So we only, at this point, hospitalize children under the age of 28 days and younger for fevers. That's a whole 2 months of a child's life that they can get fevers, and we can be confident enough that it's not a serious bacterial infection, that we're not hospitalizing them, we're not having them go through uncomfortable or dangerous procedures such as lumbar punctures, we're not blasting their gut with antibiotics. It's a lot of good that we've been able to do by decreasing the burden of bacterial illness and keeping them out of the hospital and keeping antibiotics away from our infants. So the next question comes, if we're going to be vaccinating them so young with so many vaccines, does that not itself overwhelm their immune system? And that's a really important question. And the short answer, once again, is no. One of the infants' primary jobs, like I mentioned, is to develop their immune system, and they're doing it 24/7. So you'll often notice that babies have a lot of things in their mouth, from their own toes to their own hands to hair to, in my case of my children, sometimes things I don't want them to have, like dog poop or marbles or hairballs or all sorts of nasty things, right? But that's actually a natural process for children to do, to continually expose themselves. And they actually have a specialized organ in their chest called their thymus. Now, the thymus is an organ that sits right above the heart. And one of its primary purposes is to develop the immune system and help babies know what's baby and what's not, or meaning what do I attack and what do I don't attack. So everything that they come into contact with, those antigens or those protein particles, those little microscopic things, are going to be passed through the thymus and presented by special immune cells. And if the thymus says that's not me, then it'll put up a big wanted poster in the body. And from now on, all the white blood cells, the T cells, which are named for their growth and maturity in the thymus, makes sense, right? Will then recognize and attack those things in the future. So if my baby eats dog poop and they realize, okay, that's not something we're supposed to eat, from now on in the future, the body will neutralize that dog poop before it causes serious infection. So the same thing is happening on a daily basis with thousands and thousands of antigens or protein particles that babies being exposed to. So when we give vaccinations, even when we give 7 or 8 vaccinations in one visit, we are generally exposing baby to about 2 to 3 new antigens or protein particles per vaccine. So even if a baby gets every single vaccine, they're normally getting exposed to between 20 to 25 new particles, which is really just a drop in the bucket compared to the thousands and hundreds of thousands of particles they're being exposed to on a daily basis just by natural immune development. So it by no means will overwhelm their immune system. And to believe that a baby be overwhelmed with such a simple thing is kind of a discredit to the beauty of the human body, which is just amazing, the ability it can to develop immunity in such a quick time. So then another question I often get is there a problem with waiting or delaying vaccination? And the answer is twofold. One, if you want to space out your vaccinations for babies, there's not really a problem with that. We do want those vaccines to get in within the first year of life for 2 reasons. One, that specialized thymus I talked about, that organ actually starts to go away and recede and become infunctional somewhere around 1 to 2 years of age. It's still there in its primordial form, but it's not really ramped up and huge. So if you actually look at a baby's chest x-ray before 1 year of life, you see this giant fuzzy organ above the heart, and that's the thymus. But if you look at baby's x-ray starting at 1 or 2 years of age, that thymus is actually gone and you can barely see it. It's still actually there on top of the heart, but it's not as highly functional because the baby's immune system isn't quite as active as it was. So the early exposure to those vaccinations is going to provide baby with good lifelong immunity while that thymus is still training those T white blood cells. The other thing that's so important is that the babies, like I said, are at increased risk of serious illness during that first year of life. So the early vaccination not only trains them for lifelong immunity, but as well protects them during that very sensitive time of their life when they're more susceptible than adults to these serious bacterial illnesses. So waiting will increase the risk that your child will be sick and potentially could decrease their lifelong immunity. What are some other common concerns? Well, people ask me about mercury in vaccinations. So vaccinations have gone through many, many renditions since the beginning of their existence in the early 1900s. And sometimes they have used some preservatives such as aluminum or mercury or other type of sugars or lipids or fats that use them. These days, very, very, very few vaccinations actually have mercury in them. And when they do, it's once again in a microscopic or less than 10 parts per million dose, meaning that it's just in this tiniest a bit and is mostly as a byproduct of the making of the vaccinations. It's not really put in there on purpose. It's just in the process of the chemistry that it takes to make a vaccine, there's one of those washes is used with a mercury wash. And so there can be a small byproduct. That being said, only very few combo vaccinations at this point have it in it. And with anything, it's the dose that makes the poison. So all of us create a pretty decent amount of a chemical called formaldehyde as a product of our normal body's metabolism. We have processes that create this formaldehyde and our body takes care of it and disposes of it or converts it into something else on a day-to-day basis. But if you know what formaldehyde is, it's actually an industrial cleaning agent. So people say, oh, there's industrial cleaning agents in your vaccine or in your body. Well, actually, in small amounts, our body actually requires it and uses it, but in large amounts, it's toxic. That's the case with vitamin A and vitamin K and vitamin D and all these things that we like. It's the dose that makes the poison. So once again, with mercury, our body can handle a very small amount, filter it out, get rid of it. It's not an issue. Aluminum is another big question. A lot of vaccines and even medications will sometimes have aluminum as what we call an adjuvant or an activator to help the vaccine stay potent. Now, aluminum is one of the most proliferative metals on the earth, together with iron and zinc. Aluminum is in the air we breathe, the water we drink, the food we eat, and is throughout our whole body, is used as one of the small metals that's important for many parts, and activation of our immune system requires aluminum. So aluminum is a fine metal to have in your body in very small amounts, as always. And some vaccines, not all of them, but a couple do have aluminum as what we call an adjuvant or a stimulant in order to activate the immune system. It's really no different than taking an iron or zinc as a important metal that our body requires as part of our normal metabolism. And what about other ingredients? Well, one of the big criticisms I get is, have you ever read the insert? Have you ever known what those things are putting in? And all vaccines have very different ingredients. Most of them are a mixture of something that keeps the virus or the protein particle alive or able to be recognized. So that means a little bit of sugar, a little bit of salt, and sometimes a little bit of fat so it doesn't get broken down. And sometimes there's a preservative in there. A preservative is a product that makes it so bacteria or fungus, other contaminants can't grow while that vaccine is being stored. And those are sometimes small amounts of an antibiotic or even a small antibacterial chemical. And those are used throughout makeup and food and are standardized by the FDA and regularly regulated. So if you go over to my TikTok and you see, I go through a whole bunch of different vaccines and actually read off their ingredients and explain what they are. It doesn't make sense to do that today, to go through every vaccine, but these are very tightly regulated, and most vaccines have less than 10 ingredients, which is less than the Lucky Charms you might eat in the morning. More common concerns. What about vaccine reactions? So we have a whole vaccine adverse event reporting system called the VAERS system, and it is very proliferatively used to report anything that could possibly be related to a vaccine. So what are very common vaccine reactions? Well, we normally expect vaccine reactions to happen very commonly having a little bit of fever, a little bit of swelling around the injection site, as well as having a little bit of redness or kind of discomfort around the injection site. That's just normal. That's your body mounting an immune response saying, hey, do I need to worry about this stuff or can I let it go? And once it realizes, oh, it's just something I need to learn from, it takes it to the thymus, it does its job, and the vaccine reaction goes away. There are about 1 in 10,000 to 1 in a million reactions that can happen. These can include some things like temporary paralysis of your distal extremities, some mild inflammation around the brain. But the important thing to understand about this is that this is not from the vaccine itself, it's from the body reacting to the virus or the protein particles from the bacteria. So all of these vaccine reactions that are more serious are identical or are the exact same reactions that happen when somebody's infected with the native form. So let's take, for example, COVID, because we've all had that fresh in our brain and we're all really amped up about the COVID vaccine. We know that the COVID vaccine has 1 in 100,000 to 1 in a million chance of causing pericarditis or inflammation surrounding the heart. And that's been pretty well documented, and especially in adolescent males. That is a risk of the vaccine. But we also know that COVID in about 1 in 100 or 1 in 1,000 causes significant pericarditis as one of the primary effects that it causes in all ages. So it's not that the vaccine, and pericarditis, just for clarification, is inflammation and swelling around the heart caused by your own immune system reacting to a stimulant, whether that's a virus or a bacteria or something else. So it's not necessarily that the COVID vaccine is causing that pericarditis. It's your body's immune system reacting to the presence of those protein or virus particles and causing that inflammation. That's going to happen whether or not you get COVID or you get the COVID vaccine. And it's much more likely, 10 or 100 or 1,000 times more likely to happen if you get COVID. We also know that if you have a vaccine and you get COVID, those types of reactions that you were going to get anyways are much less intense and even less likely to happen. So the same type of thing happens with our measles and mumps vaccine. About 1 in 20 children can get a rash following the measles mumps vaccine that looks like the measles rash. Well, if you get measles and mumps, you have a 100% chance of getting that rash and inflammation of the brain and all sorts of other things. And that rash is going to indicate a much more serious illness going on underneath your body. Where if you get the vaccine, you have a 1 in 20 chance of getting the rash, but you don't have those other things, and you're protected from the native form or the bad virus that's going to hurt you and really cause harm. So even though vaccine reactions can sometimes, on very rare basis, be severe, they are still much less severe and much less frequent than having the native form of the virus affect you. And it'll also prepare you to not have that effect when and if you get the native form of the illness. Another concern that a lot of people throw out there is, do they cause autism? Do they cause ADHD? Do they cause all these other things? And the big answer, resounding answer, is no. There was one study that came out years ago that linked the MMR vaccine with autism, and the studier, who is from England, got his license revoked, was multiple times proven that it was falsified information, and it was just straight up misinformation. And it's done a lot of harm to our vaccine community, and has been proven over and over and over again that that's not true. And as a uncle to multiple autistic nephews and having lots of autism in my family, it really is offensive to me, to people to say that this is something that came from vaccinations, and there's really no proof of it. But as we all know, misinformation can come from anywhere, and there you go. So let's see what good vaccines have done. So that's a lot of common questions. Do they work? Well, yeah, they do. So if we look at this graph here, this is here, it's from a real great website called Our World in Data. And you can go to ourworldindata/vaccination. And on the left-hand column here, it's in small print, so you probably can't see it very well, but it will mention how many cases per, I think it's the number of cases per 100,000 people. And that tells you how often it was happening first. And then it tells you how often we were able, once vaccinations start, what percentage reduction we were able to have just straight up in cases. And we see that across the board, we've seen a drastic decrease in number of cases. Pneumococcal and HIV being two of our, and varicella being some of our most recent vaccinations that have come on board. But with our older ones like diphtheria, measles, mumps, rubella, we've seen near elimination of the vaccinatable disease since their induction, almost 100% reduction, which is just amazing. The problem with pneumococcal vaccine is that it's a bacteria that continues to mutate or find other ways to infect us. So we don't have as significant of a decrease. It's also a broad family of bacteria that some are vaccinatable, some aren't. We continue to develop new vaccines that are actually broader spectrum and can cover more of those different bacteria strains. Similarly, we look at death reduction, which is what, we care about not getting the disease, but we also really care about preventing death. That's our job as pediatricians and doctors. And we see that almost across the board, we've reached 100% reduction in death and sometimes complete elimination of the disease with vaccination. So are they successful? Do they work? They sure do. And here is another even more important slide here. It talks about global number of child deaths per year by cause of death. And this top half here, looking back just at 1990, you see that out of 12 million child deaths per year, these are children under 5, half of those were from vaccine preventable diseases, meaning around 6 million, almost 6 million, 5.5 million children were dying every year in the whole world from vaccine preventable diseases. And by 2017, this had decreased to 1.8 million kids, or had decreased to 1.8 million. So we had a decrease of 3.7 million children that did not die from vaccine preventable diseases. So that means not only did we have less cases, we had less death. And this isn't just talking about the US or Western Europe, where we have fairly high vaccination rates. This is talking about Africa and South America and Eastern Asia, some areas where there's much less vaccination rate. Just herd immunity and kiddos that are able to get vaccinated has caused 3.7 million children per year to be saved from disease and death. I mean, just amazing. So vaccines, do they work? Yes. Are they safe? Yes. Is there a lot of misinformation about them? Yes. And it is a full-time job for me combating misinformation, I can only see 25 or 30 patients a day and talk to them about that. And that's the precise reason why I've tried to reach out via other methods, like today, you know, doing Zoom and Facebook Lives, reaching out on TikTok to try to spread the message to fight misinformation about vaccination, because it's so important. Because as we start to see more and more vaccine hesitancy, we're seeing more and more outbreaks. We're seeing polio outbreaks worldwide. We're seeing measles outbreaks in our community. We're seeing pertussis and whooping cough things, and that's just the start. And as pediatricians, we like to think of ourselves as kind of on the watchtower, trying to warn people about what's going to happen, what's going to be the next thing to hurt our children. Is it going to be guns? Is it going to be car accidents? Is it going to be drowning? Is it going to be vaccine preventable diseases that are making a resurgence because of declining vaccine rates? And if there's anything that I can say, it's that the single most valuable thing that saved more children's lives, even more so than antibiotics or hand washing, it's vaccines. As we continue to develop them and fight disease, we just save lives, and we're transforming not just children's lives right now, but children's lives in the future, that they can grow up in a world without disease. I don't know if there's an ability to take questions. This is my family and my 4 kids. So I have, 4 kids, and I'm a dad, and they're all vaccinated and lovely and healthy. And I'm more than happy to handle any questions or go over anything else.
Thank you, Dr. Ross. That was really awesome. I appreciate how many different places, you answered a lot of the questions I was going to put forth. So one question, and you started to touch on it. One of the questions that I see a lot is, why are we still giving vaccinations for polio? Why are we still giving vaccinations for some of these that, I don't know anybody that's had it, why am we still doing it? And you started to talk about it. So can you elaborate a little bit more on that?
That's a great question. And really, like I talked about, we're not just preparing children we're not just protecting them for now, we're protecting them for life. So we currently have polio outbreaks in Africa. We have polio outbreaks in Eastern Europe, even some parts of Western Europe. And those people are coming to see us, right? And we actually just got a notification from Lane County that we should watch out for unvaccinated children, because we have a lot of people coming here to Eugene for our world championships. They're coming from all over the world, and they may or may not be vaccinated. They may be carrying diseases with us. And when our children are older, they are going to go to places that we don't know. I mean, they're going to go join the Peace Corps or serve as missionaries or travel the world. And my fear is that if I, as a pediatrician, don't appropriately protect children as a parent of pediatrician, and they go and get a life-threatening disease because they weren't vaccinated against, or they got their vaccine late in life and their immunity has waned because they didn't get it during that sensitive immunity building period, then I failed them, and they could have been protected and avoided that illness, and they're not. So important to even vaccinate against diseases that aren't eradicated. For example, smallpox. We don't vaccinate against smallpox anymore because we did a worldwide campaign where every single person was vaccinated, and we eradicated it, and we don't have to vaccinate against it more because it only exists in laboratories or in some storage container, right? But we're not there with polio, and we're not there with Haemophilus influenza B and measles and mumps. These are still around. So that's why we do still need to be vigilant about vaccinating for them, is to protect our children now and for their whole future life.
Mm-hmm. Great. And, it's important to emphasize that, there's, just because it's not in our community at the moment, it doesn't mean it won't be here.
Yeah.
Even if you don't go anywhere, people are coming here. And there's a lot of that is still around, that even if we don't see it, chickenpox. Well, I don't know anybody that's died from chickenpox. It doesn't mean that somebody hasn't. It doesn't mean that it's not possible. And do you want your child to be that one person, or the fact that they may give it to somebody that may die?
Yeah. And a lot of times it's not about preventing death. I mean, that is the big overwhelming one.
Right.
But all these diseases also carry what we call, morbidity. So some can cause, infertility, or can cause deafness, or can cause pregnancy loss. So not only preventing death, but also preventing the burden of disease. And even if it's just a couple nights in the hospital, like preventing that. I do everything I can to keep kids out of the hospital, and vaccination is one of those things that can do it.
Yes. Yeah, no, and I think that we don't see, there's a whole couple of generations now that don't know the burden of polio. Even if you
Yeah.
don't die from it, it is a lifelong uh, burden. Um, I was talking about, you mentioned pertussis. My mom had whooping cough when she was a kid, and she's had lifelong issues with her lungs.
Mhm.
You know, just because she had a pretty good case when she was a kid.
Yeah.
Uh, and we don't think about it anymore, but it's something that is preventable, and we don't have to think about it, which is grateful. But there are times in our life we do need to still prevent it.
And we need to trust the people who have seen it, right?
Yeah.
I've had to do chest compressions on a child who is put into a coma because they're seizing so bad because of pus on their brain from meningitis from a vaccine preventable disease. And I never want anybody to be in that position. And so, as a person who's been there, I'm like a broken record, whether it's a kid riding on a bicycle without a helmet or a kid on the lake without a life preserver. Once you've seen that, you can't stop preaching about it, and oftentimes we can come off as fear mongers, but it's not that. It comes from a place of concern and love for every child, just like our own. So they don't have to go through what we've seen.
Mm-hmm. Exactly. Susan, did you have any questions or comments for Dr. Ross?
What you said about travel resonated with me because, well, the screen changed. Some of, for these, I was doing a lot of world traveling some years ago, and for certain trips, you're supposed to get certain vaccinations like tetanus before you go to Ireland. And there was some stuff before going to India. But then I'd be traveling in India with a group, like in a Buddhist pilgrimage, basically. It was a couple years in a row. And on both occasions, all of the people who were not local, who we were traveling with, would catch a virus. We all got sick and spread it. But it was one of those things where you've got phlegm and congestion and you're coughing a lot. So yeah, that comment reminded me of that. It's like because you're in a different country, whereas the Indians we traveled with, they probably had this disease, this virus when they were little kids, and they're immune to it. None of them got it. So
Yeah.
Oh yeah, I did have a question. So once COVID is like closer to being perfect, will it be one of those vaccine? You mentioned that it should become an annual vaccine. Will it be one of those things that babies get during their first year, do you think?
Well, so yeah, we're working on, the FDA is meeting, I think it's June 9th, to discuss the emergency use authorization of the Moderna COVID vaccine for ages 6 months to 5 years old. So the flu vaccine is currently authorized for 6 months and up. And so we anticipate that the COVID vaccine will start being a yearly thing that's administered at 6 months.
Okay.
My colleague, Dr. Braun, who's the infectious disease doctor here at our clinic and also advises on the Lane County health department. So she has said since the beginning that she anticipates that COVID is just going to become what we call endemic, meaning it's just like flu. It's going to wax and wane every year. And new variants are going to come out every year, and we'll likely get a COVID and flu vaccination to prevent big spikes and big surges and prevent hospitalization. And, whether it's the BA.5 or the BA.6 or the BA.75 variant, you'll have a COVID vaccine you'll get on a yearly basis that'll protect you from the likely variants that year, as well as the flu vaccine, which we're very used to getting. And that'll likely start at around 6 months of age, their first administrations.
Okay. I had one other question. I don't know if you would know the answer to this one. It was some time ago. An acupuncturist told me that he got his COVID, I think it was after his first COVID shot. And I think he got Moderna. And he said he read the description and knew what it meant, that basically there was antifreeze in that particular vaccine. Do you know why there would be antifreeze? Is that a preservative?
That's going back to what they're referring to as most times formaldehyde is what they're
Oh,
referring to.
okay.
So you're going back to people taking broad generalizations of chemical, like if you tell somebody that they have, bihydrogen peroxide, in their blood, you're like, oh, that's just water, right? 2 hydrogens and an oxygen. But using a chemical name or a broad generalization saying, oh, there's antifreeze. Well, formaldehyde is a chemical antifreeze as well as a preservative and a rinsing agent. And like I said, those types of chemicals are used and made in our body every single day, and our body takes care of them or converts them to something else. So it's not a harmful thing. And even if it is something that in large doses can be harmful, like aluminum or mercury or something like that, it's always the dose makes the poison. So for example, we ingest small amounts of toxins all the time, every day. We'll eat a bug, or something will be contaminated in our lettuce, and our body, our liver and our kidneys and our spleen, that's their job, is they rinse it and they take it off and they pee and poop it out. And in small amounts, it's not a big deal. Same thing with an intramuscular injection. There could be a small amount of something that in a large amount would be poisonous, but our body just says, okay, that's not supposed to be here, puts it into the bloodstream, goes to the liver, is put into bile, which is the breakdown product of a lot of different things. And the bile goes into our poop, and there it goes. And the toilet takes care of it. So not really, our body is pretty amazing at not only keeping us alive, but keeping toxins out of there. And as long as we take care of our body, with sleep and eating fresh foods and not overloading it with exhaustion, and we're sleeping and exercising and eating well, our body takes care of us. And we don't have to worry about small contaminants every day because our body gets rid of them.
Great. Those are great questions. Thank you, Susan.
Oh,
so we have a question from Facebook. You mentioned combating misinformation is like a full-time job. Do you see it working? What's your best strategy, most successful?
My most successful strategy is to meet people where they are, right? I can't stand on a soapbox and preach. And I can't do something that I'm not willing to put into play myself. So for example, I have a patient who comes in and they don't want to get any vaccines because they're 100% convinced that they're all evil and that they're all just from big pharma companies, and they just want to make money off of them and kill their child. And I say, do you trust me if I tell you that your kid has an ear infection? Well, yeah. Would you trust me if I told you your child needed some speech therapy? Well, yeah. Would you trust me if I told you that I vaccinated my kids? Well, yeah. So then I kind of make that small jump in logic. Do you think that I would ever do anything that I would harm your child? And then that small jump, sometimes I can get them to say, you know what, let's just try with one vaccine for something that your child's at really big risk for. Let's go for Haemophilus influenza B or pertussis, something that there is a present danger for your child, and let's try there. I don't try to go all or none. I don't find that approach works. This is what motivational interviewing is all about, whether you're trying to get people to stop smoking or stop drinking or exercise more, right? You're not trying to go cold turkey. You're trying to just meet them where they're at and slowly advance it and dispel one belief after the other. The biggest thing with misinformation is people don't know how to recognize good versus bad information, right? In an age where bad information is easily put out by anybody with internet access, and good information is hard to get because it's behind paywalls, or you have to pay for studies, or you have to go to medical school or lawyer school. I mean, it's hard to understand that, and really just being honest with people and just trying to take that next step in judgment or education and help them understand one misconception. And then it's a slow journey. I have tons of patients that prefer to do one vaccine at a time or do a delayed schedule or whatever. And we talk about the risks and benefits of that, but I've had a lot more success doing a kind of stepwise approach instead of an all or nothing approach.
That makes total sense. I have to say that I know this isn't exactly the topic we're talking about, but my mom was one of those vaccine hesitants for the COVID vaccine.
Mm-hmm.
And she's like, well, I don't know what's in it. And I said, do you know what's in any of the other vaccines that you have taken your whole life, Mom? Had all the vaccines that you drug Richie and I to get? Why is this one different? Tell me what is different about it. And it really comes down to that misinformation. It comes down to that to that media presence that was happening around this particular vaccine. And I think that that's a lot of what's happening is we have such a big presence around that. And so we have to work harder than they do to work around it. And I like your approach. I think that's very good for a lot of things, not just vaccines.
And I always ask, hey, do you know what's in your cereal you ate this morning? Like, sure, it's listed on the box, but did you do a chemical analysis to guarantee it? Like, you have to trust at some level, whether it's trusting that your Wheaties only have those ingredients and nobody spiked it with something else. Yeah, in our society where we do depend on some regulatory organization to tell us what's in something and what's not, we have to have that level of trust.
Yes, totally. Trust is important. Thank you so much, Dr. Ross. This has been amazing.
You are so welcome. I'm happy to do it. And if you have any other things, feel free to go on TikTok and drop a comment or something. Or if you have an idea or something like that, let me know, because that's really my only way of kind of reaching out to people outside of my clinic to try to help battle misinformation and give good answers. But thanks for having me.
Why don't you give a little plug for your clinic?
Yeah, well, I'm Eugene. We're Eugene Pediatric Associates. You know, we're just pretty awesome. We're a group of 5 pediatricians who just love kids, and we're very, very busy. So, and we take all kids, all insurances, and yeah.
Great. Thank you so much.
All
I
right.
really appreciate it. I know you're busy. So again, I'm Leah Murray. I'm with the Shelton McMurphy Johnson House. This has been a presentation as part of our vaccines from pustules to MNRA. The vaccination exhibit goes through the end of May this month. Go ahead and visit us, and thank you to the Oregon Cultural Trust and the Lane County Cultural Coalition for funding this. And Dr. Ross, I will get a hold of you about some things in the future. All right. Thank you, everybody.
All right. Thank you, guys.
Thanks. Okay. Oh, just about.